Hi, and welcome to LaserAid's Hifu tips and techniques. In this video, we'll talk about how Hifu, or high intensity focused ultrasound, works, and we'll also cover some basic techniques on how to ensure high quality, safe treatment. Before we begin, remember that Hifu is an advanced treatment and should only be used by a trained practitioner. If you're interested in training, head to laseraid.com.au for more. Now let's talk about the science behind high intensity focused ultrasound. Hifu, as it's also known, uses focused ultrasound to create pinpoint thermal heating in 3 different levels of the skin. It can target the epidermis, which is the top layer of the skin, the dermis, which is the main part of the skin, and the SMAS layer, which is where the tissue and the muscles join together. Hifu can lift, tone, and tighten the skin. Clients generally need between 1 to 3 sessions depending on their age. The treatment itself takes about 45 minutes to 1 hour and is generally pain-free. When the high-focused ultrasound pinpoints its target tissue, it induces the wound healing process, which in turn stimulates collagen and elastin, lifting and tightening the skin. Clients will notice an instant lifting followed by a progression of lifting over 3 months of treatment program. Treatments can be spaced 2 to 3 months apart if need be. Because they're working so deep in the skin, there are a few things that clinicians should be aware of. These are the do's and the don'ts of Hifu. Do mark out the area that you are treating. Our Hifu device comes with a pre-measured facial ruler. This facial ruler will tell you exactly where the handpiece will sit on the client's face. As you can see, this makes the process much easier and avoids missing areas or over-treating the skin, which actually can be quite dangerous for the skin. Do work on different layers in the same treatment. During our training sessions, we highly recommend that you choose 2 depths of the skin that you do per treatment. For example, the first time a client comes in, you may choose to do a 4.5mm depth followed by a 3mm depth. This will target 2 separate areas of the skin and give the client an overall lifting and collagen inducing treatment. For the second treatment, we would do maybe a 3mm depth targeting the dermis followed by a 1.5mm depth to really tighten and tone the epidermis, focusing on superficial lines and wrinkles. Do use a conductive gel when doing your treatments. Ultrasound needs water to conduct through the skin, so an ultrasound-based gel is the product of choice for the ultrasound to penetrate effectively. It also improves the client's experience because not using a gel can be painful and at least uncomfortable. Do only move 2mm at a time per pulse. This is really important so that you don't miss any areas and so that you really create the thermal damage exactly where it's needed. Do a test patch. Don't guess. Everyone has a different heat and pain threshold, and you need to ensure that you're giving the client the best possible treatment for their skin based on the treatment guidelines and the parameters provided by the manufacturer. Now to the most important part. Don't treat certain areas of the face. There are certain areas of the face that you must never treat to maintain the safety of the client. The best practice is to mark these areas so that we don't accidentally treat over them. Now, one of the areas is the thyroid area. This area is very sensitive and we don't want to be treating it to avoid unnecessary damage. Another area that we don't treat is what's called the nasolabial line. This area is full of fine nerves that we want to stay away from. To ensure that you don't treat over this area, you would leave about a finger's width spacing and you would treat from that point across the face. We also don't treat near the ear. There are muscles there that we just don't need to go over. They're highly sensitive. We also don't treat around the temple, the forehead, because the skin is quite thin there. There's not a high concentration of fat cells, and it's not really an area that needs to be lifted. We also avoid the cheek area because we don't want to eliminate any plumpness in that area, making the treatment counterintuitive. And this is what a properly marked out face should look like. Those are our key Hifu basics. If you require any more information or have any questions, you can email inquiries@laseraid.com.au. Thanks for watching.